I'm one of like 50,000 applicants. How do I land this job? Hi, my name's Trish. I'm back with another interview, and today I'll be giving you 6 interview tips to help you ace the job of your dreams. Just a little background about me. I was a new grad about 2 years ago now. I basically wanted a job in Southern California that had magnet designation in their hospital, was a teaching hospital, and had a new grad residency program. And while there are a lot of programs that do that, in my head I was thinking, look, I'm one of like 50,000 applicants. How do I land this job, and how do I make myself stand out and be the person that they want? And what I've come to find out was that it's not just important to show up on interview day, but it's also important to do some background prep. So I'm going to share with you my tips. So let's jump into it. Tip number 1 would be to create a list. So when I was applying to places on the first days before the applications were due, my friend and I created a spreadsheet of places that we were looking into applying. And we basically wrote the name of the place we were applying to, the location, its residency program dates, its application dates, any contact number for the recruiter, and any notes. And in our notes section, we would include if the hospital was religious, if they were like a level 1 trauma center, level 2, level 3, or things like that that we were made us more interested in applying for that place. Tip number 2. I would do my research. So if there was a few hospitals that had application dates that were coming up, I would definitely take the time to look on their website for their mission, vision, values, and see how I could work that into how I was as a person, and definitely see if it aligns with what I was looking for in a hospital. Because at one point or another, you'll be asked why you want to work at this hospital, and it looks really good if you did your research as to what sort of equipment they have, what sort of mentality they're trying to promote, and how that relates to you. And that really shows and makes you stand out as a candidate that you did your research. Also, a tip for that would be, in doing your research, if you're applying to a specialty unit, such as an ICU that's specialized, like maybe it's surgical versus a medical ICU, do your research on like how many beds they have, like what their main issues are. So because you might be asked some sort of clinical questions, such as what are some surgical complications that you might see, or how do you prioritize A, B, and C patients. And just note that not every place will do a behavioral and a clinical interview. Sometimes you'll just have one interview that'll do both. Sometimes you'll have places that just do behavioral because they believe that they can teach you the clinical skills, and that you yourself are a new grad, and that even though you have gone through all the school, they can teach you all of that. But it depends on every hospital. So it's just important to come prepared with some sort of clinical knowledge as to what your specialty will be. Tip number 3 is to clean up your elevator speech. No matter where you go, every hospital is going to ask you, why did you want to become a nurse? And it's just important to have a really succinct answer that isn't over practiced and that really kind of rolls off your tongue really well. They might also ask you why you decided to specialize in what you do. So you can tie that into your why you decided to be a nurse, or you can have a completely different statement, but make sure that both are very short and sweet and to the point. For me, I talked a little bit about how my grandmother was a nurse, and how if you watched my previous video about how I got into the school of nursing, then you'll remember that I talked about my grandma and how I watched her hands dance as she took care of patients, and I thought that was super awesome, and that's why I became a nurse. But then my why did I choose ICU was because my grandpa got really sick when I was 14, and it just felt really like isolating and scary to be in the ICU where no one was really explaining the types of machines that he was on and like what was going on with the situation. And so for me, I wanted to be that person that would help educate others and make the ICU less scary. Tip number 4 would be to come prepared. So when I had my very first interview, I brought the nursing portfolios that I was going to give to my employer on site with me, but I realized halfway to my drive in the middle of traffic that I forgot my big leather-bound portfolio. And I knew I wasn't going to give the leather-bound portfolio to the employers, but I just thought that it would be a really nice addition to just have it on me. So I made my mom drive out in the middle of traffic at like 7:30 in the morning to my interview, and that caused me so much stress because she did not get there until maybe like 10 minutes before, and then I was running through the door trying to fill out paperwork that I probably should have showed up 15 minutes for, and I couldn't because I was outside waiting for her, and that was really stressful. So make sure you come prepared. Also, in the setting of being prepared, your employer will have questions for you, and that brings me to point number 5. For tip number 5, I would just basically write a list of experiences that you had in your clinical days that can kind of reflect back how you can answer questions. Maybe write about like some memorable times you had, good times you had, learning experiences, and write those in a notebook and just see how you can apply those to different questions that you might find online. Some questions that you'll have will be like, what are your strengths and weaknesses? Describe a time you worked in a team. Explain a time when you provided excellent patient care, or where do you see yourself in 5 years? For me, my interviewer asked, what during your immersion did your preceptor say about you? And I wasn't really sure what she meant, if that was positive or negative, but then when I heard the second part of the question, which was, what did your preceptor say that you could do better? Then I took a step back. Don't take too long, but just take a second to say, okay, what is she really asking me? So what she said was a way of her phrasing strengths and weaknesses in a different way. And while it threw me off at first, taking a step back really kind of helped me to like just think about what I wanted to say and to answer those questions in a way that was that helped me, that showed that I reflected on what I thought I did well on and what I think I didn't do well on. A tricky question that your employer might ask you as well is, where do you see yourself in 5 years? And while you can always say, I plan on going back to school, which may be a truthful answer, sometimes the units want to see that the money that they've invested in you as a new grad when you get hired will be put to good use on their unit. So some answers you can have that are different than saying that you want to go back to school would be to be, well, I see myself precepting students because I'm really interested in the educational aspect. You can also say that you would love to join a unit practice council if that sounds like you, or maybe if you're not so much into like spending that extra time on your unit for extra meetings, you can say that you would like to help out with something that maybe isn't as time consuming, like if there's a unit newsletter of emails that they have to send out, or if you want to be a champion for something such as falls or helping decrease CLABSI rates, things like that. Those are unique ways that you say you can give back to the unit in your 5 years that you're there. At the end of your interview, your employer will probably ask you, do you have any questions for me? And if you say no, it doesn't really look good on you because it looks like you didn't do your research and that you are not really interested in their company or in their unit. So make sure you come with a few questions, whether it be like, what would you say is the culture of your unit like? Things like that that aren't super hard, but maybe are different, and things that you probably like couldn't look up on the internet. My last tip for you guys would just be to always say thank you. So when you're done with your interview, obviously shake their hand, tell them thank you, but I would say like in 2 weeks, if you have the time, reach out and just send them a letter or maybe drop it into HR. And in your letter, you can say, dear interviewer, unit director, whatever, write their name out. Say, thank you so much for taking the time to interview me for the position of, and whatever it is. And then recount something that really stood out to you when they were interviewing you. For example, I remember you spoke highly of X, Y, and Z, whether it be your unit's culture of teamwork, or your low collapsy rates, or something, or your low number of falls for this certain amount of time. That makes me really excited to work there. And then you could talk about skills that you have that would make you an ideal candidate. But remember to keep it short and sweet, maybe like 2 or 3 things that just like you really touched upon during your interview. And then possibly reiterate aspects of your interview and clarify things where maybe you felt like you didn't explain yourself well. And that could really take you from being a maybe candidate to a yes candidate. Remember to keep this short and sweet. If you have to, take these notes down right after you have your interview so that in 2 weeks' time when you have to write this letter, you remember what you want to say. And then once again, just say thank you. Like, once again, thank you for taking the time to interview me. I really hope to be hearing back from you soon. Sincerely, and then your name. And those are my interview tips. If you kind of want to read them in a more extensive way, you can go ahead and I'll drop the link to my blog down below. It's on my blog. You can also reach out to me if you have any questions in the comments down below, or feel free to reach me on Instagram. Just note that I might take a little bit of time to reply, but I will get to you as soon as possible. And thank you so much for watching this video. If you have any other ideas of what I should post, please leave them down below. Okay, bye.